We know not everyone can afford health care, and putting off treatment can cause even bigger issues. So today, Samantha Cleaver and Clark Delabar of Kentucky Fast Care are here to talk about their low-cost labs. Thanks for coming in.
Yes.
Yeah.
Good afternoon.
Thanks for having us.
Don't know the concept of that name, so you got to explain to us. What does this mean?
Yeah, so Kentucky Fast Care has a self-pay urgent care model. I've been in the medical field in the area for 15 years, and I see patients that don't have health insurance or maybe have very high deductibles, and they kind of neglect their health care needs, and medical care doesn't have to be expensive. So Kentucky Fast Care, we take care of minor illnesses and injuries. We're very transparent with our pricing. Patients, might pay $40 to come in for a sick visit. We have a full-service lab, other diagnostic services that we can offer at Kentucky Fast Care.
That is great. So explain a little more about how this works. What are the benefits for a patient maybe choosing a self-pay urgent care center, especially with all these, it is expensive everywhere.
Yes.
The main thing that we're trying to do is make it very transparent on the pricing. You can get on our website, look at the pricing before you even come in, so that when you come in, you know what your price is going to be.
No surprises.
No hidden fees, no surprises, no, oh, I'm sorry, insurance didn't cover this, here's your bill. You can come in, like she said.
That's not the way most hospitals work. No. That's not the way most doctors work.
No, not at all.
Yeah, we don't have to worry about prior authorizations or, maybe insurance comes back and says, hey, we didn't pay for that, or your claim was denied. That middleman is kind of cut out. So when you come in for a visit at Kentucky Fast Care, we are staffed with nurse practitioners, nurses, medical assistants, and we're able to take care of all of your minor illnesses and injuries.
Does it play into how long I have to wait for the care?
Oh, absolutely. Because we don't have to do the prior authorizations or check your insurance, put everything in. When you come in, you sign in, we check you in, and you're ready to see her. I mean, it is right in. You see her right out, because at the end we don't come back and say, okay, we ran your insurance, here's this, here's that.
Right.
You already know what your price is, or if something came up while she's assessing you, hey, we may have to do an EKG, it's going to be $100.
Yeah.
She can tell you right then and there what it's going to be. You can assess it, and you know what?
I don't have any money to match that.
Right. I don't think I want to do that today. Okay, no big deal. And then when you leave, you know exactly what you're paying. No surprises.
Okay.
And what all can you treat?
So all minor illnesses such as common flu, ear infection, sore throat, poison ivy, injuries, for athletes that might have a sprained ankle or a broken bone, maybe they have a laceration and need sutures. We also have a full service lab that we can do all lab draws and urinalysis. Even if you're not coming in for a sick visit and your primary care provider, your cardiologist, wants a full panel of lab work, and it's going to cost you, X amount of dollars at a hospital. We can give you transparent pricing of exactly what the cost of those labs are going to be prior to you getting your blood drawn. And so, as far as the full service lab, we can do urinalysis, EKGs, and we can treat all minor illnesses.
And you do it all right there?
All right there.
And we've also partnered with another self-pay company that does all of our imaging for us. So X-rays,
and
stuff like
X-rays,
that. That also helps keep the same model as us, which helps keep the price low and transparent also.
Right.
Yeah, they offer X-rays, echocardiograms, CT scans, ultrasounds, and sometimes those cash pay models are much cheaper than a high deductible, or don't neglect your health care because you are uninsured.
And we've talked to a lot of our viewers who do not have insurance. It's not available to an awful lot of our viewers.
Right.
Yeah.
So this plays into this.
Yeah, that was kind of the model and why we opened. I've seen it for 15 years, and lots of patients just neglect their health care because they don't have insurance, and then they wait till something major happens, and a lot of things can be preventable if they just had access.
Catastrophic.
Exactly.
Right.
Yeah. So your philosophy, you're not going to turn anyone away.
No.
All right.
Yeah. So remind us where you're located, because you all just opened at the beginning of the year. You're still relatively new. Where are you located?
Tell us about it.
Yeah, so we're located at 1454 Diedrich Avenue, or Diedrich Boulevard, sorry.
Boulevard.
Right there in Russell, Kentucky.
Yeah, we're located right next door to KY Aesthetics and Wellness, so very close to the Russell Independent School District. We are staffed with 3 nurse practitioners, 3 registered nurses, and we also have 3 medical assistants. Myself and Laura Allen is another nurse practitioner. Combined, we have over 40 years of medical experience.
Interesting new model. Well, guys, appreciate you coming in.
Hey, thanks for having us.
Thank you so much.